Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. I want to talk about gastroesophageal reflux disease, or GERD. Gastroesophageal reflux disease is one of the most common causes of chest discomfort in the United States. To understand GERD and its treatment, it is first necessary to understand normal swallowing and how the esophagus or food tube and stomach work together. Whenever we swallow, food is pushed into the back of the throat by a complex series of coordinated muscle contractions. When the food is in the back of the throat, our body closes off the trachea or windpipe to prevent the food from going down into our lungs. The food is then pushed into the upper part of our esophagus or food tube. Once the food is in the esophagus, the muscles in the middle part of the esophagus relax and open up, while the muscles in the front part of the esophagus squeeze down and propel the food into the middle part of the esophagus. At this point in time, the muscles in the end of the esophagus relax, while the muscles in the middle part of the esophagus squeeze down, further pushing the food down into the stomach. Because of these series of muscular contractions and relaxations, we can actually swallow food while upside down. In the bottom part of the esophagus or food tube, where food is emptied into the stomach, there is a very strong muscular ring called the lower esophageal sphincter. Normally, this muscular ring acts like a one-way valve, only permitting food to pass from the food tube or esophagus into the stomach. Ordinarily, this valve is closed shut. The only time this valve normally opens is when a person is actively swallowing. As soon as you have finished swallowing, this valve will close shut, sealing the food in the stomach. The normal action of this muscular ring is extremely important since the stomach is designed to handle acid, but the esophagus is not. If this muscular ring or valve relaxes when food is not being swallowed, acid can pass from the stomach into the food tube. When the acid gets into the food tube, it can literally burn the food tube, causing a condition called reflux esophagitis. The acid irritates the lining of the food tube and can cause the muscles in the food tube to go into spasms, producing pains that can be identical to the pains of having a heart attack. Most people describe the pain from GERD or reflux esophagitis as heartburn or indigestion. If the reflux is severe enough, you can actually taste the stomach contents in the back of your throat, a term called water brash. Reflux esophagitis, or GERD, produces unpleasant sensation. However, when the problem continues for several years, the chronic irritation from the stomach acid can cause a condition called esophagitis, and its most advanced form is known as Barrett's esophagus. The problem with Barrett's esophagus is that it can and often develops into cancer of the esophagus. Hence, it's very important to properly treat GERD. There are three major types of therapy for GERD: non-drug therapy, drug therapy, and surgery. Since the fundamental problem in GERD is failure of the muscular ring or valve to remain shut, permitting stomach acid to pass into the esophagus from the stomach, the main non-drug therapy is to avoid the things that naturally cause this muscular ring to relax. They are alcohol, chocolate, coca, caffeine, especially in sodas, coffee, even decaf, tea, theophylline, a common asthma medicine, high doses of estrogen, the female hormone, calcium channel blockers such as Norvasc, Procardia, Verapamil, and the like, and nitrates, common heart medications. Since water flows downhill, nighttime reflux of acid can be substantially reduced by elevating the head of the bed by using extra pillows. Usually 4 to 6 inches higher is enough. Wearing loose-fitting pants or belts while sitting will also reduce reflux, since this will decrease the pressure on the stomach and make the acid less likely to go up into the food tube and more likely to go down into the intestines. Weight loss will also reduce reflux, again by reducing physical pressure on the stomach. Most medicines that are used for GERD work by neutralizing stomach acid, reducing the amount of acid produced in the stomach, or even work by accelerating the removal of stomach acid into the intestines. The best medicines are the proton pump inhibitors, the oldest being omeprazole or Prilosec. Prilosec virtually completely shuts down the production of acid within the stomach for 24 hours. It is very convenient since it only needs to be taken once a day. It is very effective in relieving pain and has been proven to reverse esophagitis and Barrett's esophagus. Therefore, it should prevent cancer from developing. One of the nice features of Prilosec is that it has almost no side effects and it has only one significant drug interaction with clarithromycin, an antibiotic. Prilosec has been used safely in patients for well over 5 years in the United States and more than 10 years in Europe. When the combination of drug therapy and non-drug therapy fail, surgery is an option in which the surgeons create an artificial valve at the lower end of the esophagus. This, however, is not always a permanent solution. When medications fail to solve the problem, surgery is our last option. I hope this educational video has helped you better understand gastroesophageal reflux disease, or Gerd. Thank you very much. I'm Dr. Eli Whitney from the Heart and Vascular Institute of Texas.